In a move that's sure to rile up the lefty gender ideologists, the region's peak psychiatry college has said it now does not endorse gender-affirming care, that's surgery and puberty blockers and all of that stuff, as the key intervention for children who believe they may be transgender. It's a huge shift by the Royal Australian and New Zealand College of Psychiatrists, and here to talk about it is Dr. Geroge Halas. George, thank you so much for telling us about this. What is the story here? What has happened? What has prompted this really remarkable change?
Thank you, James. I agree with you. It is really absolutely remarkable and almost unbelievable in some sense. The trigger for it has been coming a long time. And I was speaking with Peter Credlin about a month ago about overseas trends. And it is really this overseas trend that has been picked up in this latest Royal Australian New Zealand College of Psychiatrists position statement, which focuses on the role of psychiatrists in care and working with transgender children and adolescents and adults. The main thrust of this paper, the position statement, is for some people common sense, but for other people it's a radical departure from the trend that has been pervasive for the last 10 to 15 years. What I speak of here as the major shake-up is that it defines sex as a biological characteristics that define the human being as being male or female. Now, for some people this may seem commonsensical, but if you've been following and immersed in the debates and seen some politicians being questioned in Senate hearings and elsewhere to define what is a man, what is a woman, and they really sort of struggle, like they really are lost for words, it is so refreshing to hear the college that I belong to just say that sex is a defining characteristics. They go on also to define gender and gender dysphoria and gender incongruence and all the technical things.
And yet, Doctor, this comes out of years and years of this being the opposite direction, and you would have had an awful lot of young people, and we saw the case of the Tavistock Clinic in Great Britain and all sorts of other issues around people who've decided to detransition around the world, in the U.S., here, the U.K. There's been an awful lot of people who have suffered greatly because this common sense hasn't been the common practice. Isn't that right?
Now, James, you've touched on one of the major advances of this position statement. It is to actually acknowledge that there is such a thing as detransitioning, which means that those youngsters who thought they wanted to transition and go through social transition, medical transition with hormones, some with surgical transitions, which are really virtually irreversible, then they decide that they want to go back to their original state, which of course creates major havoc in their lives. And this population has been virtually disenfranchised in previous position statements and guidelines. The position statement from our college puts this smack square in the debate that you cannot have a gender debate without having the outcome of detransitioners acknowledged and the specialist care that they also will require, perhaps long-term, perhaps for life, as they come off their medication and try to revert back to their original biological state.
And Doctor, doesn't this also bring into question some of the stuff that we see? I mean, you see things like children's books that are aimed at 3- and 4-year-olds, aiming to try and tell them, hey, you might think you're a boy, but you're a girl, and all this sort of thing, in the same way that, little kids might think that they're a dinosaur or something like this, and trying to medicalize, what are sort of normal stages of growth for a lot of kids.
And that's one of the thrusts of the power of this position statement. It reinstates what's called developmental thinking. As you say, James, children go through normal phases of what's called magical thinking. And the previous ideology, or current even in many places, of the affirmation model does not distinguish a 3-year-old's magical thinking from genuine, some of them are genuinely transgender even at the age of 3. So I have to emphasize that.
Sure.
This is a very nuanced paper, and I acknowledge the nuances, and I don't want to be simplistic and override the years of work that goes into such research.
Absolutely. Absolutely. Dr. Geroge Halas, we're going to have to leave it there. It's absolutely fascinating. Dr. Geroge Halas from Monash University, appreciate your telling us about this important development.